Hi everyone, my name is Kaylee Marston. I'm a speech language pathologist at Levine Cancer Institute. Thanks for joining me for part 2 of our cognitive and communication changes in cancer series. Today we're going to be talking about cognitive and communication changes that we see in cancer-related cognitive impairment, better known as chemo brain. If you remember in part 1, we talked more about the central nervous system related cancers such as primary brain tumors and metastatic lesions. So today we'll be talking about different reasons for cognitive and communication changes. So cancer-related cognitive impairment, that's a mouthful, CRCI, honestly is better known to the general population as chemo brain. This term became a little more kind of controversial or changed over time in the medical community because we found that this occurs in individuals with cancer who did not undergo chemotherapy. And so we felt that it didn't really kind of encapsulate everyone that it applied to. So, what is important to differentiate is patients who have cancer related cognitive impairment have changes to their cognitive functioning as a result of cancer, as well as other factors. But it has to be cancer that is not in the central nervous system, meaning cancer that is not in the brain. So these are individuals who do not have brain tumors, they do not have metastatic brain lesions of the brain, and yet they do have cognitive changes. So we'll talk a little bit more about why that is. But again, go to part 1 if you want to kind of hear more about those individuals who have brain tumors or metastatic lesions. So again, in chemo brain or cancer-related cognitive impairment, it can occur even in individuals who don't have chemotherapy. And there's a lot of different factors that contribute to this. It's cancer itself present in the body. It is treatments such as chemotherapy and radiation, even though the radiation is not to the brain. It can be due to factors related to genetics. It can be due to a lot of psychological factors such as anxiety and stress. It can be exacerbated by things like fatigue. And so some of it is, it's come a long way as far as what we understand about it, but there's still a lot of unknowns. But again, the key thing is that you can have cognitive and communication changes as a result of cancer and cancer-related treatments that have nothing to do with having a brain tumor or any structural changes to the brain itself. Oftentimes, these symptoms can last for months to even years. And, we find that people may come to us right after finishing chemotherapy and noticing a difference or other treatments. They may even start to have cognitive changes around the time of being diagnosed. But because people get referred to us at all different increments, it does make it hard to pinpoint kind of when people truly start to have a change. So what are some of the symptoms of chemo brain? I'm going to just kind of overview the most commonly ones that I see here at the cognitive clinic and the ones that I address the most with patients. I would say attention is probably number 1, and that can look like really high level attention. So having difficulty concentrating or focusing, even though you may be trying to and it wasn't difficult before. This also tends to relate to deficits in some short term and like working memory, although attention and memory are pretty interlinked. But people will report things like being really forgetful, having difficulty remembering names or appointments or like details of conversations. I find that people feel like they need to use more cognitive effort to do like what they consider normal day tasks, and that overall they feel foggy or like they're kind of functioning, like their mind is going a lot slower. In terms of communication, people will say they have difficulty finding their words at times. They know what they want to say, but things aren't coming to them as quickly or as efficiently and consistently. And so they feel like their thoughts seem jumbled when they go to express themselves. Many people report suddenly needing a lot more supports, things like calendars and post-it notes and to-do lists and reminders. And overall, this really reduces someone's ability to kind of function at what they've been used to, even before having cancer, before undergoing treatments. And this, I find, really, really results in a lot of increased stress and frustration and anxiety. fatigue, and all those things then further exacerbate the very problem that they're having. I think a lot of it also goes to the fact that many of my patients who have cancer related cognitive impairment are still very high functioning. And what I mean by that is maybe they went back to their jobs or their daily life, even after going through cancer and cancer treatments. But now suddenly those very tasks that they've done for a while are a lot harder. And so they really, really feel the impact of that. So hopefully that gives you just a brief overview of cancer-related cognitive impairment and some of the symptoms we see. Join me for part 3 when we talk more about assessment and treatment. If you have questions or comments, please leave them below in the video, and don't forget to like and subscribe our YouTube channel. Thanks.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.